one of the most successful project of IAP Kerala, which was started in 2023 and it is running successfully in year 2024 also. So with this, I invite the state coordinator of IAP Kerala PG Tips, Dr. Shankar VH, to deliver the welcome speech.
Good evening, all. Am I audible? Jose, am I
Yes,
audible?
sir. Yes, sir.
Okay. Thank you, Krishna Mohan. Thank you, Jose. Respected Santosh Sounds, Chief Guest of the Day, Dr. T.U. Sukumaran sir, my teacher, Ramesh Kumar sir, past National President, Dr. Shimmi, President, IAP Kerala, Jose, last year President, where we have started this PGT program, Krishna Mohan, our Dynamic Secretary, Dr. Riaz, President-elect, and Susi and others in the audience. Thank you very much for giving me the opportunity. I am very happy today because last year in January 23, when Jose was President and I was Vice President, and we have decided to start this PG Tips program. I don't know how far it will be successful. But last year, without any break, we were able to release the 52 issues every week. And the 25th issue, the special program was chaired by none other than Piyush Gupta. And 15th issue, it is chaired by the then this year National President, Kanitkar. And today also, 75th issue, we got a special person. He is one among us, but at the same time, he is a very highest post in the National President. He was National President, but he is just like front of us only because he came to Trivandrum also as an examiner twice. And I am welcoming Santosh sir for this August program for this 75th issue inauguration. And I am very happy that all our faculty were regularly giving the article, and definitely we will be able to reach the 100th issue because already we have floated 25 different topics to different people under preparation. Some are with me, some are with reviewers, and definitely we will reach the 100 and we will have a very good program in 100th issue also. After that, we have to see whether we have to continue or not because so many other pressing issues also is there. But definitely we will continue because already around 25 topics has been given to various faculties. And I am very thankful to the IAP Kerala, especially last year President Dr. Jose, who have entrusted me for this task. And this year President Dr. Shimmi, he has advised that please continue the program. The IAP Kerala will always support us for doing this program. And I am welcoming all other senior faculty, T.U. Sukumaran sir, past National President, Dr. Ramesh Kumar sir, past National President, Dr. Shimmi, President, IAP Kerala, Krishna Mohan, Secretary, IAP Kerala, Jose, past President, IAP, last year President, IAP, Dr. Riaz, President-elect, my good friend, Susi Joseph, who is the mentor of today's topic, and today's presenter, Neetu, and all other faculty who joined this program. Thank you for the opportunity. Over to Krishna Mohan.
Thank you, sir. Now I invite Dr. Shimmi Paulos, IAP Kerala State President, for the presidential address.
Respected Chief Guest of the Day, Dr. Santosh sir, our past National President, Sukumaran sir, as well as Dr. Ramesh, the state chairperson of the PG Tips program, Dr. Jose, who is also the IPP of Kerala State, and the state coordinator for the PG Tips program, Dr. Shankar, the state secretary, Dr. Krishna Mohan, President-elect Dr. Riaz, and definitely the today's presenter, Dr. Neetu, and her mentor, Dr. Susi, and all those who have joined us on the platform today. Definitely, PG Tips program was a great hit last year, and this year also it is running strong. I to sincerely thank Dr. Shankar sir for having continued the program, for taking it up in a big way, and definitely this the issues that have been released, which has been sent all over pan India, some of them with doubts, and some have even appreciated the topics that were selected. So I think so, Dr. Shankar needs a big applause for the work that he has done, because to coordinate this and bring it out every week, it's a big task, and readily he agreed to do it this year also. So once again, thank you, Dr. Shankar sir, and also thanks Dr. Jose for leading the way. As the Dr. Jose being a perfectionist, he will just make sure that things are done in time. So it will be a learning issue even for the PGs as well as even for the practicing pediatricians. That is one thing that I've seen by this issues that have been released so far. So wishing the program all the best, and next let's let the century be hit soon by Dr. Shankar and team. So over to the Dr. Krishna Mohan for the rest of the proceedings. Thank you.
Thank you, sir. So as Shankar sir mentioned, we released the 50th issue in style with the presence of Dr. Piyush Gupta sir. So today, to release the 75th issue, we have none other than Dr. Santosh Sones, our past president of Central IAP, who is very much dear to all IAP members in Kerala. So with this, so we are very much thankful to you, sir, for being with us today. So with this, I invite Dr. Santosh Sones for the inauguration and inaugural address.
Yeah, good evening, everybody. It's great to see a lot of my friends and my past president of Indian Academy of Pediatrics, Sukumaran. We should say there was one of our mentors who sort of brought us into the IAP and nurtured us. And my very good friend, I think Ramesh and myself were together in those years where he was my secretary and later, and one of the most distinguished year as a president he had. And respected president of IAP Kerala, my good friend, and he was my EB also, Dr. Shimi Paulos, then the past president, Dr. Jose, then I think anybody who can start a program, but bringing that every month, every week, the same thing for the 52 weeks is a great achievement. Dr. Shankar, I should congratulate you for that. And we have Krishna Mohan, the IAP secretary, then all the other, Susie, who's one of the mentors for today's program. I think it has been a great this one. So it's a remarkable achievement of PG Tips program. It is very instrumental in shaping the academic landscape. If you see, when I asked my PG sometime, do they see the PG Tips program? Many of them said yes, they're doing it. So definitely it is under this visionary leadership of Dr. Jose. I think last year he started that synergy. Along with that, I think PG Tips, and it is going on. I think I'm very happy. A milestone of 75th program, I am able to sort of bring that this is there. And definitely it was his action plan. Every president in IAP has his action plan. But there is a difference in other states and Kerala, because Kerala state is doing this its own presidential action plan, which is almost equal to the CIAP program, because we should really appreciate, because many of your inauguration program where you as a presidents took over that. So I was there, and the number of the presidential action plan were really almost equal to the programs of the central IAP. Each week this PG, I was just looking at it, it's been releasing cutting edge content on the topics that was not really available on a contemporary textbook material. So this is what the PGs will not get it when they read this textbook. I'm sure this strategic approach has empowered our PG student to tackle the examination in much better way, with better confidence, armed with the latest insight and information. And definitely, as you said, because it's not only the Kerala state PGs are flocking for this program, but it is also the other postgraduates, which has a lot of participants across the countries who are enthusiastically joining this thing. So, and also I heard that which message which you sent, that you're coming out with a printable material, which is there. I would advise that it should be also digital also, so that, because now if you see any of the books we give it to this PGs, they will not read it. It is the digital, this thing what they are always more interested in that. So as we gather here to honor the visionary leaders like Shankar, Joe, Shimi Paulos, and Krishna Mohan and all that, I can't help but to feel that deep sense of admiration and gratitude for their unwavering dedication and betterment in our education system. It's a time when they really read, because they need these kind of things, because otherwise that old teaching, bedside teaching, and the teachers giving extra tips is not there. So definitely your commitment to innovation and student-centric initiatives, Dr. Jose, has really, I think it has set a new standards for postgraduate education. I think definitely seeing that, I think the postgrad, even in the CIP has taken it and somebody else is doing it. Definitely, I think today, as I stand here, I think everybody should applaud the effort of Dr. Jose, Dr. Shankar, Dr. Shimi Polos, Krishna Mohan, and all of you who have made this into this as a grand success. I'm sure in no time, Shankar will be able to bring out the 100th issue of this PG Tips program. And finally, thank you all for inviting me to this grand affair of 25th issue of this PG Tips program. May this issue continue to inspire and empower the next generation of postgraduates also. And also not only that, and even the pediatrician also, I'm sure they can help, and this will help in their bright future and most informed future, because when they come out, they should be sort of equipped to handle this unusual thing which is not there in the textbook. Definitely, Jose, your program as a president has really been a success. I wish this program to continue even during Shimi's time. I think with the mentors like Sukumaran, Ramesh, and all that who are there in Kerala, definitely this is going to continue. Thank you so much for asking me to be there with my Kerala friends. Thank you so much.
Thank you so much, Santosh Sound, sir. That was really encouraging. So thank you for your presence. Thank you so much, sir. Now I invite for the felicitations.
Krishnamohan, 1 minute, 1 minute.
Release the
Shankar will release the article, 75th
Okay.
article.
Okay, sir. Okay.
Krishnamohan, make Shankar as a co-host. Any
He
issue?
is a co-host, sir. Already he is a co-host.
1 minute, 1 minute. Jose, can you do that? I'm not able to do it from here.
That is not with me.
Okay. 1 second, 1 second. I don't know whether I'm not able to do that. I will just check
Okay,
it.
then Krishnamohan continue.
Continue. I will check it. 1 second. 1 second.
Okay, sir. Okay, sir. We will release it in the WhatsApp. No issues. Okay. So for the okay, sir. It's not an issue. So we will proceed with the inaugural function. So for the felicitations, first and foremost, I invite our dear Dr. Ramesh Kumar, sir, President of IAP 2022. So over to you, sir.
Thank you, dear Krishna Mohan. And as always, it's quite exciting to hear Dr. Santosh's voice every day, anytime, anywhere. And it is so quite heartening to hear him greet our youngsters. President Dr. Shimi, a wonderful team going ahead. President-elect Riaz, all smiles, waiting to take over the reins, and past President Dr. Jose. And of course, always Sukumaran sir leading us from the French academic as well as in all matters. And for me personally as a teacher. And all my dear friends, Shankar the coordinator, as well as Krishna Mohan the state secretary, who has been at the HEM at the back office for the last 2 years, and Susi and other faculty, and I can see Kedar Malvarkar and few other friends around. Good evening, and so happy to be there with this great occasion where we are having that, what do you say, the 75th issue of our PG Tips. And I I think I should prompt Shankar to go further ahead, because it's not like 2 years. Riaz, your dear friend is waiting for 1 more year. So 52 into 3, 156 volumes have to be there. Sorry. And just like we did for that STG, Tranda treatment, 150 topics, I think easily doable. Shankar has got a great team behind him. So it's once it starts going, and once there are 2-minute takers and a lot of acceptance and visibility around, that should be the inspiration for you to take it further. And as Dr. Santosh has been quite vehement about the Kerala's action plans or presidential action plans, has always been taken across on board across the IAP platforms. Maybe digest, what do you call it? We have got very fun, very catchy themes. Digest, rainbow, what do you say? Currently, synergy for JOS last year, and all those activities. So Dr. JOS clearly had a vision ahead, and that is the 52 volumes have come out very easily last year. Shankar taking it earnestly, and this year also it's going well. And as been told, discussed earlier, we had a compilation of the 52 editions last year. And the digital version should also be made available, as noted by Santosh sir. And so maybe the teachers like Dr. Santosh, Dr. Sukumaran sir, and Josh, Shankar, all of you will be quite, quite inspired to continue with these great efforts. And I should congratulate all at the office, especially Shimmy and Krishna Mohan, for taking it forward. And it could be a great time when for the PGs also getting an opportunity to present it, and for the faculty also to get to have their own grounds tested, how good they are as a faculty and maybe as a teacher in another platform. So it's always gives multiple opportunities for the new faces to be more visible and to establish themselves as faculty. It's all a lot of opportunities. So Josh, again, congratulations to conceptualizing this, and as a great taking it forward, and Shankar and others, Krishna Mohan, the team taking it forward, and Shimmy, and of course, I believe Riaz also again taking it forward. So best wishes to all the team, and we are really proud of IAP, what this PG Tips from IAP Kerala reaching its 75th milestone. Going ahead, 75 into 2, 150, another 1.5 years is easily doable, and let us look forward to it. Thank you, and Jai IAP, Jai Hind.
Thank you so much, Ramesh sir, for those encouraging words. Now I invite for felicitations Dr. Jose O, our immediate past state president. He is the person who initiated this program. Basically, this idea is from
Not audible, Krishna.
He has lost his connection, I think. Joseph, please, you can.
Joseph.
Sorry. In between, I
Okay,
lost connection. Thank you, Krishna Mohan. Respected the IAP chairperson, Dr. Shimmy. Our chief guest, our own friend, Dr. Santosh sir. Our IAP Kerala leaders like the past person, Dr. Sumar sir, Dr. Ramesh Kumar, Secretary Dr. Krishna Mohan, Riaz, and all the delegates and faculty joined here. It is a very proud moment for IAP Kerala is concerned. We are initiated the program because of initiation by our leaders like Sumar sir and Ramesh, given the inspiration to formulate actions. Actually, this action plan is actually the inspiration from Ramesh Kumar, the idea to release a journal, because Ramesh Kumar in his action plan and Central IAP has released the module every weekly, the national level. That was the initiation for standard treatment guideline by national level. That was the initiation for we had to do something for PGs. That's why inspiration we started the program PG Tips. Initially, after Dr. Shankar mentioned, we have a lot of we may not we are not sure that we are able to fulfill our vision. But the leadership done a wonderful job, and I think the opportunity, I take a special congratulations to Dr. Shankar for doing all the coordinating with our faculty and placing every weekly in a systematic manner with the support from our Micronova. That is a very thoughtful action plan for IEP Kerala is concerned. I wish you all the best, and for the program, Jai Hind, Jai AP.
Thank you, Jose sir. Now invite Dr. Riaz I, our President-elect, for his felicitations.
Sorry for keeping the video off. We are having a power cut here. So, our most affectionate friend of IAP Kerala, Santosh Son sir, my dear Sukumaran sir, Ramesh sir, and all my friends here. I think this is the result of a combination of two people. One, a taskmaster like our Jose sir, and a go-getter like Shankar sir, because I have worked with both these people, and when they decide that something is to be done, we can consider it done. So as everyone has told, in the next year also, we are going to continue the program, but in a way which Shankar sir also like to continue. And I think this is one of the most important programs which IAP Kerala has ever done for our postgraduates. And these are the ways how we can actually make our postgraduates and young pediatricians to our lot. And thank you, and congrats again, and best wishes. Bye.
Thank you so much, sir. So with this, we come to the end of the inaugural function. So I take this opportunity to thank one and each of you, especially our dear Dr. Santosh Son sir, for his valuable presence, Ramesh Kumar sir, Jose sir, Shankar sir, and all senior IAPians who are present for this program. Now we will proceed directly to the academic session. Today we are having a wonderful, very interesting topic on cow's milk protein allergy. And the presenter is Dr. Neetu Chandran, and the mentor is Dr. Susie Joseph, who is the additional professor of pediatrics at Alappuzha Medical College. So to chair this session, we have none other than Sukumaran sir, or Dr. T.U. Sukumaran, the past president of IAP 2011. And there is no need to introduce Sukumaran sir to the IAP community. He is well-known all over India. So with these words, I invite respected Sukumaran sir to chair this session.
Okay, thank you, Krishna Mohan. Am I audible, Krishna Mohan?
Yes, sir. Yes.
Okay, beloved friends, Dr. Shimi, Dr. Jose, Ramesh, and all my beloved friends of IAP, Dr. Riaz also, and all the participants. Let me at the outset thank the organizers for giving this opportunity, and I should congratulate Dr. Jose, Dr. Shimi, Dr. Shankar, Dr. Krishna Mohan for releasing the 70th issue of PG Tips. And definitely these PG Tips are going to be beneficial both for PGs and also practicing pediatricians as well. My heartfelt congratulations to all the officials behind this program. And today is the 75th issue, and Dr. Neetu Chandran is going on a very common topic, the cow's milk protein allergy. See, as you all know, cow's milk protein allergy, CMPA, is the commonest food allergy that we see in children, with varied prevalence of nearly 7 to 8%. As you know, there are different types of food allergies are there. And cow's milk protein allergy also, there are two types are there. One is the IgE-mediated and non-IgE-mediated cow's milk protein allergy is there. And also it is very important to detect it early and treat it promptly. So to talk on this subject, we have Dr. Neetu Chandran, and now I invite Dr. Neetu Chandran to talk on cow's milk protein allergy. Dr. Neetu, please. Dr. Jose will start now. Invite Dr. Neetu Chandran.
Start. Neetu.
Okay, sir.
Neetu, you can start. Krishna Mohan, whether Neetu is a co-host now?
I can
Oh,
share
1
my
minute.
screen.
1 minute, 1 minute. 1 minute, 1 minute. Your name, you have given the name as Neetu only, right?
Yes, sir.
Okay.
Krishna Mohan, enne kudi co-host aakavo.
Okay, now you can share. Okay, Joseph.
എന്നെ കൂടി ഹോസ്റ്റ് ആക്കിയതേ.
Okay. Dr. Neetu, you can share it now.
Yes, sir.
Make slideshow, make it slideshow.
Sir, is this visible?
Correct.
Good evening, everyone. Today I am going to present the topic cow milk protein allergy. Before that, I would like to thank IAP Kerala and especially Jose sir and Susie madam for giving me this opportunity. So let's start. So cow milk protein allergy. The introduction. Cow milk protein allergy is a hypersensitivity reaction to a cow milk protein, mainly casein and beta lactoglobulin. And CMPA peaks in infancy, that is 1.5 to 3%, and falls to less than 1% at 6 years of age, and it resolves almost all cases before adult life as tolerance to milk protein develops. And CMPA may have cutaneous, respiratory, and gastrointestinal manifestations. The diagnosis is challenging because many of the presenting symptoms are common in healthy infants, non-specific, and there is absence of sensitive and specific diagnostic tool for CMPA. Then what is the importance of diagnosing CMPA? Because misdiagnosis of CMPA can happen both over and underdiagnosis. The underdiagnosis can lead to allergic or acute reaction, failure to thrive, growth altering, and micronutrient deficiencies. And overdiagnosis can lead to unnecessary dietary restriction, causing nutritional rickets, hypoproteinemia, diminished quality of life of infants and caregiver, which adds to financial burden. And there are 3 types of CMPA. First one is IgE mediated. This is also known as immediate reaction, usually occurs from minutes to within 1 hour. Involvement of 2 or more systems are seen. Then non-IgE mediated is also known as late reactions. The symptom onset is delayed and develops usually more than or equal to 24 hours. And usually after 5 to 7 days, predominantly GI manifestations are common in non-IgE mediated CMP. Then mixed reactions, which is the onset is intermediate with more than 4 hours and within 24 hours. Coming to the individual, IgE mediated CMPA, the onset is immediate within 1 hour of ingestion of cow milk protein. It can manifest as periorbital urticaria or erythema, angioedema or anaphylaxis, generalized rash, vomiting, wheezing, cough. The non-IgE mediated, it can manifest in wide variety of symptoms, mostly GI symptoms, the enteropathy, where watery diarrhea, failure to thrive, protein losing enteropathy, and occult GI bleeding, enterocolitis, bloody diarrhea, anemia, hypoproteinemia, esophagitis, reflex-like symptoms, vomiting or feed refusal or dysphagia, gastritis or gastroduodenitis, hematemesis, occult GI bleeding, and proctocolitis, where fresh bleeding per rectum and constipation can happen. And coming to the clinical features in general, in digestive system, the CMPA can cause dysphagia, frequent regurgitation, colic abdominal pain, vomiting, anorexia, refusal to feed, diarrhea, intestinal protein loss or blood loss, constipation with or without perianal rash, failure to thrive, occult blood loss, iron deficiency anemia. Immediate symptoms in digestive system include vomiting. In respiratory system, it can cause runny nose, wheezing, chronic coughing, which is unrelated to infections. And immediate symptoms are wheezing, stridor, breathing difficulty. In skin, it can manifest as urticaria, which is unrelated to infection, drugs, or other causes. Atopic eczema, angioedema. The immediate symptoms are urticaria and angioedema. In general, can cause anaphylaxis and most severe forms like food protein-induced enterocolitis syndrome. And immediate symptoms are anaphylaxis. And food protein-induced allergic proctocolitis. It's in an infant having mucus and blood in stool, but are otherwise healthy appearing. It's seen in breastfed infants between 2 to 8 weeks of age due to maternal ingestion of foods, most commonly cow's milk, soy, egg, and corn. Food protein-induced enterocolitis syndrome, profuse repetitive vomiting 1 to 8 hours after ingestion of cow milk protein, usually seen in infants younger than 9 months of age, often when complementary foods are introduced in their diet. It rarely occurs in breastfed infants who are fed cow's milk or soy-based formulas. In mild to moderate cases, present with repetitive emesis, with or without diarrhea, pallor, and mild lethargy. In severe cases, it may present with repetitive projectile emesis, with or without diarrhea, pallor, lethargy, dehydration, hypotension, shock, and metabolic acidosis. Food protein-induced enterocolitis syndrome can be acute and chronic. In acute presentation, it's due to intermittent food exposure. The emesis starts within 1 to 4 hours. It's accompanied by lethargy and pallor, and diarrhea can follow within 24 hours. Resolution of symptoms within 24 hours after elimination of food from the diet. The growth is normal in such children, and a child is asymptomatic during food trigger elimination. In chronic FPIs, daily ingestion, diarrhea, or weight gain, or failure to thrive, return to their usual state of health within 3 to 10 days of switching to a hypoallergic formula. Acute symptoms after subsequent feeding following avoidance. And there is a diagnostic criteria for food protein-induced enterocolitis syndrome, which is published in 2017 Norwalk. There is major criterion and minor criterion. Major criterion, vomiting in the 1 to 4 hours after ingestion of suspect food and absence of classic IgE-mediated allergic skin or respiratory symptoms. And the minor include a second or more episodes of repetitive vomiting after eating the same suspect food, repetitive vomiting episodes 1 to 4 hours after eating a different food, extreme lethargy, marked pallor, emergency department, need for intravenous fluid support, diarrhea in 24 hours, hypotension, hypothermia. So among this, major criterion and at least 3 out of 9 minor criterion is needed for diagnosis food protein-induced enterocolitis. Coming to the diagnosis of CMPA, it's a challenging process where CMPA is a clinical diagnosis, no single test or biomarker that is pathognomic of this condition. So current ESPGHAN 2020 suggests the initial diagnosis of CMPA should be made on the basis of diagnostic elimination of cow milk protein from the diet of a child or infant, and this has to be confirmed by a double-blinded placebo-controlled oral food challenge. A diagnostic elimination test. So response to CMP withdrawal is noticed within 3 to 5 days or 1 to 2 weeks in case of immediate manifestation, that is IgE-mediated CMPA. In 2 to 4 weeks in those with non-IgE-mediated CMPA, chronic diarrhea, and failure to thrive. If there is no improvement during this time period, during elimination diet, a diagnosis of CMPA is ruled out. Then exclusively breastfed infants with CMPA may react to cow milk protein from maternal diet. So breastfeeding with maternal elimination of diet for cow's milk and related product must be considered for 2 to 4 weeks. In prolonged maternal elimination diet, supplementation of mother with calcium and vitamin D is recommended, and supplementation with iodine and vitamin B12 must be considered. For non-breastfed infants, hydrolyzed formulas are used during the elimination period. For older children, all forms of milk and milk products should be stopped as a part of the elimination. And there are different hydrolyzed formula which is used during the elimination period. One is partially hydrolyzed cow milk based formulas, PHF, extensively hydrolyzed cow milk based formula, EHF, rice based hydrolyzed formula, RHF, soy based formula, and amino acid formulas. These hydrolyzed formulas are according to degree of protein hydrolysis in cow's milk. In partially hydrolyzed formula, it contains oligopeptides with a molecular weight of 3000 Dalton to 5000 Dalton. So because of the residual allergenicity of the peptides is too high, exposing the infant to a risk of severe reaction. So there is no role in management of CMA for these partially hydrolyzed formulas. So extensively hydrolyzed formula, which is produced by extensive hydrolyzation of casein or whey protein, which is followed by hyperfiltration, and molecular weight of peptide is less than 3000 Dalton. and majority of having less than 1000 Daltons, so it can be extensively used. Then amino acid formula, which consisting of only free amino acid instead of protein, hence it's an allergen-free formula since it contains no peptides that can elicit immune reactions. And soy protein, which is based on infant formula containing enzymatically hydrolyzed soy protein, which is not hypoallergenic. 10 to 14% of infants with CMA will also become allergic to soy, so recommended only after 6 months of age. Then rice-based formula, there is limited studies only, is more effective than soy and comparable to casein hydroxylate in infants with CMA, safe in children allergic to milk and soy. An extensively hydrolyzed formula is the most widely used elimination diet. 2 to 10% of uncomplicated CMPA and 40% of complicated CMPA are intolerant to extensively hydrolyzed formulas. Extensively hydrolyzed formula relieves symptoms in more than 90% of cow milk protein allergy. No improvement in extensively hydrolyzed formula, we can switch to amino acid formula since no component of amino acid is derived from cow's milk and amino acid formulas are considered 100% effective in treating CMA. Infants showing lack of improvement on extensively hydrolyzed formulas need further testing with amino acid formula before CMPA can be excluded. So amino acid formula is reserved because of the high cost and financial burden for the bystander. It is reserved for anaphylaxis, multiple food allergies, severe CMPA, food protein-induced enterocolitis syndrome, food protein-induced enteropathy, failure to thrive, and extensively hydrolyzed formula intolerance, and eosinophilic esophagitis. After diagnostic elimination test, we have to confirm it with oral food challenge test. So children with improvement in symptoms after elimination test should undergo confirmation of diagnosis with OFC after 2 to 4 weeks of CMP-free diet. A double-blind placebo-controlled food challenge is gold standard for diagnosing CMPA. An oral food challenge is more specific test and reliably distinguishes sensitization from clinical allergy. So after oral food challenge, if the child is asymptomatic after 2 weeks, then CMPA is ruled out. If symptoms recur, then CMPA is confirmed. Procedure of oral food challenge. The cow milk protein either as formula or pasteurized milk is administered cautiously in the following manner. 1 ml, 3 ml, 10 ml, 30 ml, and 100 ml given every 30 minutes, which can be done on an outpatient basis. The child should be observed for 2 hours and then sent home with an instruction to continue at least 200 ml of milk per day and to stop if there is recurrence of symptoms. And child is reviewed after 2 weeks to decide to continue milk or stop milk depending upon the clinical response to milk introduction. In children with severe reaction or IgE response initially, milk challenge is done in a graded fashion. Instead of starting with 1 ml, it should be started with 0.1 ml, 0.3 ml, 1 ml, 3 ml, 10 ml, 30 ml, 100 ml given every 30 minutes. As an inpatient with all the resuscitation facilities, including injection adrenaline to manage the anaphylaxis reaction. A positive reaction to milk introduction confirms the diagnosis of CMPA. If no reaction occurs, 200 ml per day of milk is continued for 2 weeks to look for any delayed manifestation. This is the oral food challenge with cow milk protein. So in non-IgE mediated, it can be started with 1 ml, 3 ml, 10 ml, 30 ml, and 100 ml over 30 minutes. Then severe reaction is expected. Then 0.1 ml, 0.3 ml, 1 ml, 3 ml, 10 ml, and 30 ml followed by 100 ml over 30 minutes can be given. If there is no reaction, continue 200 ml per day of cow milk protein and stop if reaction occurs and re-challenge later at 18 months and 3 years. And other tests to diagnose cow milk protein allergy. One is determination of specific IgE, skin prick test, endoscopy, and biopsy. First one is determination of specific IgE. Detect the specific circulating antibodies against the cow milk protein rather than total IgE. Not useful in non-IgE mediated cow milk protein allergy. Positive specific IgE does not confirm allergy nor differentiate between sensitization and clinical allergy. So it's useful with acute or life-threatening symptoms such as stridor, wheeze, angioedema, and anaphylaxis. The oral challenge test may be delayed by an year if CMP specific IgE is positive. The level of specific IgE increases does have predictive value regarding the development of tolerance. Higher the IgE level, greater the risk of CMA will persist. Then skin prick test. To detect the presence of IgE tissue-bound antibodies. Positive test does not confirm allergy. Infants are generally less responsive to skin prick test. And wheal size of more than or equal to 5 millimeter, and in less than 2 years of age, more than or equal to 2 millimeter is associated with the highest specificity. In children with persistent disease, wheal size will be larger, hence useful as a prognostic indicator. A negative skin test rule out IgE mediated reaction with a negative predictive value of 95%. With endoscopy and biopsy, non-IgE mediated GA symptoms are more common in India. So confirmation with sigmoidoscopy with rectal biopsy should be considered in children whose parents do not give consent for oral food challenge. Upper endoscopy findings suggestive of CMPR, esophagitis, gastritis, and lymphoid nodular hyperplasia in duodenum. Lower endoscopy suggests focal mucosal erythema, loss of vascular pattern, erosions, ecchymosis, lymphoid nodular hyperplasia. The presence of more than 60 eosinophils in 6 high power field and or more than 15 to 20 eosinophils per high power field is highly suggestive of cow milk protein allergy. Then coming to the approach to a child with suspected CMPA, adapted from ISPACAN 2020. In case of clinical suspicion of cow milk protein allergy, it is non-IgE allergy or anaphylaxis or immediate type of reaction. In non-IgE allergy, diagnostic elimination test given for maximum 4 weeks. So additional sigmoidoscopy and rectal biopsy for enterocolitis presentation can be done. If there is a response with the diagnostic elimination test for 4 weeks, then standard oral cow milk protein challenge can be done. If it is negative, CMPA is rule out and refer to specialists for further evaluation. And if it is positive for OCT, then CMPA is diagnosed. Then we can give therapeutic elimination diet. If there is no response to diagnostic elimination test, CMPA is ruled out. In anaphylaxis or immediate type of reaction, CMPA elimination with or without specific IgE. If specific IgE is available, it may be positive or negative. If it is positive, CMPA is diagnosed. Then we can give therapeutic elimination diet. If it is negative, we should do standard oral cow milk protein challenge test. If it is either positive, CMPA is diagnosed. It's negative, CMPA is ruled out. And if the specific IgE is not available or a CMPA elimination is done, then the specific IgE is negative, CMPA is ruled out. The management of CMPA. The safest strategy for the management of CMPA is strict avoidance of CMP for a definite period. The elimination diet is only for a limited period and re-evaluation should be done periodically. Factors to consider when considering alternative to milk include age, feeding pattern, types of allergy, severity of reaction, clinical manifestation, financial burden. So in exclusively breastfed infants, the exclusive breastfeeding is continued till 6 months of age. Mother is advised to avoid bovine milk and all dairy products as well as milk containing foods in diet. It will take 72 hours for antigen to disappear from milk or clinical response. Maternal elimination diet maintained for 3 to 6 days in IgE-mediated allergy and 2 weeks in non-IgE-mediated allergy. And infants on mixed feed, breastfeeding should be continued without elimination in maternal diet. And cow milk protein avoided completely along with all unmodified animal milk proteins. Children with IgE-mediated CMPA tolerate soy protein better than non-IgE. In infants more than 6 months with mild to moderate reaction, soy protein formula instead of extensively hydrolyzed formula can be given because of the financial constraints. And if it is less than 6 months, we can use extensively hydrolyzed formula. And severe life-threatening symptoms, amino acid formula is the first choice. In exclusively formula-fed infants, breastfeeding must be started if they were stopped recently. And rest of the management is same as that of infants with mixed pain. In management of IgA mediated CMPA, in children presenting with classical symptoms like angioedema, urticaria, and anaphylaxis, emergency care should be provided. Immediately withdraw all the forms of CMP. And in mild to moderate allergy, extensively hydrolyzed formula is the first choice. Only those who do not respond to extensively hydrolyzed formula should be switched to amino acid formulas. And those with severe allergy requires hospitalization and should be given only amino acid formulas. An oral food challenge should be done with caution only in a hospital settings between 12 to 18 months. An elimination diet should be continued for at least 1 year and re-evaluation done every 6 months. In management of non-IgE mediated CMPA, in case of non-IgE mediated CMPA, if it is a mild to moderate reaction, age more than 6 months, then soy protein formula can be given during elimination period. If there is improvement with symptoms, then continue soy protein formula. Then OFC, oral food challenge, should be done in 3 months. Soy protein formula, there is no improvement of symptoms, and switch to extensively hydrolyzed formula. In mild to moderate reaction, age less than 6 months, extensively hydrolyzed formula is used because soy protein have cross allergy. And improvement of symptoms, then continue extensively hydrolyzed formula, then OFC in 3 months. In extensively hydrolyzed formula, child having no improvement of symptoms, switch to amino acid formula, then OFC should be done at 1 year. In case of severe reaction with age less than 6 months, amino acid formula and OFC should be done at 1 year. Coming to the prevention of CMPA, primary prevention include the aim to delay first exposure of infants to cow's milk protein. Secondary prevention involves avoiding antigen exposure in high-risk atopic infants. Tertiary prevention, cow milk avoidance as means of treatment after confirmation of diagnosis. And best way is to exclusively breastfeed till 6 months. Why exclusively breastfeed till 6 months? Because the cow milk protein, which is secreted in breast milk from the milk milk consuming mother, is very less than 1 lakh, below 1 lakh, compared to directly consuming cow milk. And also the immune factors which is present in the breast milk also helps in preventing allergy. And the breast milk contain proteases which helps in digesting the cow milk proteins in the diet. In prognosis of cow milk protein, prognosis of cow milk protein is good as 50% will tolerate CMP by 1 year, more than 75% by 3 years of age, and more than 90% by 6 years of age, and less than 5% will continue in adulthood. And high total IgE and specific IgE levels correlate with a higher age of acquiring tolerance. And tolerance develop higher in non-IgE mediated CMPA. And there is a newer concept in management of CMP is the Indian milk ladder. So this is an article which is published in MDPI in 2023. The need for culturally appropriate food allergy management strategies, the Indian milk ladder. So Indian milk ladder is for reintroduction of cow milk protein in a home-based management. So this is used in infants and children with cow milk allergy for reintroduction of milk and milk product under supervision of healthcare professional at home. And it consisting of 6 steps of milk ladder. First step is we can gradually increase the amount of protein, that is 0.05 grams of protein per serving, with increased cooking time of 15 minutes with cooking at 180 degrees Celsius. And step 2 is we can gradually increase the amount of protein in diet, that is 0.75 gram per serving, with cooking time of 20 to 25 minutes by boiling. And step 3 is slightly lower amount of protein, that is 0.74 grams of protein per serving, with a lower heating time, with frying for 2 to 3 minutes or steaming for 15 minutes. And step 4 is with increased protein, that is 3.5 grams per serving, with boiling for 30 minutes. Step 5, increased protein of 3.7 to 6 grams per serving with no cooking. And step 6 is pasteurized milk with high protein up to 8 grams per serving. By this, we can gradually reintroduce milk in the diet. So it's like a sensitization to milk and milk product. So milk ladder can be used safely in non-IgE mediated allergy, excluding food protein induced enterocolitis syndrome and IgE mediated food allergy with prior mild or non-anaphylactic reaction, and considered for individuals with stable and treated asthma, the ability to understand and comply with instruction provided, a high previous reaction threshold, and lower decreasing skin prick test, wheel or serum specific IgE levels. Conclusion: CMPA is most common food allergy in infants, and focus history is vital to CMPA. It's important to accurately diagnose CMPA to avoid consequence of either under or overdiagnosis. Prompt diagnosis and appropriate management decreases morbidity. Use therapeutic enteral formula judiciously in CMPA. Extensively hydrolyzed formula relieves symptoms in more than 90% of CMPA. There is no firm evidence on prevention apart from recommending breastfeeding in early life along with initiating complementary feeding between 4 to 6 months of age. These are my references.
Okay.
Thank you.
Thank you, Dr.
Neither can it stop sharing?
For an excellent presentation of this topic.
Yes, sir.
Now this topic is open for discussion. Any questions or doubts you can have. Then before that, I will ask few questions to you. As a PG, you must know. Then before that, I will ask few questions to you. As a PG, you must know all these things. What do you mean cow's milk intolerance? Nidhu, are you hearing?
Nidhu?
Yes, sir.
What is cow's milk intolerance? And what is the difference between cow's milk intolerance and cow milk protein allergy?
Sir, any adverse event after ingestion of cow milk and its component?
What is the classical example? Example of cow milk protein intolerance. The classical example is lactose intolerance.
Lactose intolerance.
The intolerance to the component is called cow milk intolerance. It is different from cow milk protein allergy. One more question. What do you mean by High-Nair syndrome? You have not mentioned about this. High-Nair syndrome associated with cow milk protein allergy. High-Nair syndrome. Have you heard of High-Nair syndrome? Nidhu?
No, sir.
No. In the cow milk protein allergy, lung is commonly affected, and these children can present with pulmonary hemocirrhosis. Pulmonary hemocirrhosis, severe anemia, and cow milk protein allergy is called High-Nair syndrome. And X-ray shows multiple infiltrates can be there. Diagnosis may be confirmed by using a bronchoalveolar lavage, and bronchoalveolar lavage may show macrophages laden with hemocirrhosis. So this is called a High-Nair syndrome. The last question: what is the role of immunotherapy? Is there a role for immunotherapy in children with cow milk protein allergy? Immunotherapy? Nidhu? Do you know what is the role of immunotherapy? Is there immunotherapy is indicated?
It causes tolerance to
Rarely it is indicated, but immunotherapy can be tried in children with a persistent cow milk allergy. It can be tried. Then there is a question from I think Dr. Amit Beda from Rajasthan is here. He has asked a question: what is the cost of this amino acid containing formula? Any idea?
Sir.
What is the cost of this amino acid formula for treatment of CMPA? Any idea?
I will tell, sir.
Yeah.
Sir, I will tell.
Okay.
Yes, sir. The difficulty in getting this amino acid formula is very much because we do not have it available freely. So many a times we have to depend upon this Amazon or some other platform or through the medical agents to get this thing. It is very costly. It is in the range of around a 500 gram will cost around 5,000 to 7,000 rupees.
It is available in Amrita.
Very
Amrita
costly.
Institute. Amrita. Dr. Banu is routinely giving a amino acid formula to the children with proctocolitis. He's giving. Then any comments from
The commercially available like Neocate, Telecare and all,
Neocate,
they are very difficult to procure, very costly.
Neocate is available in Amrita. Amrita, they are giving this Neocate routinely. Then any comments from Susie Joseph? Susie,
Yes, sir.
any comments?
So that was a very, no, sir, it was a very good presentation. And only, sir, as you asked, the concept of immunotherapy, actually, that immunotherapy concept is based upon the immunotherapy concept is the Indian milk ladder. So they have actually put forward the Indian milk ladder from step 1 to step 6. And it is actually almost in par with the immunotherapy, because there we are actually increasing the protein content and decreasing the cooking time. So that is actually creating a sort of tolerance to the cow's milk protein rather than completely stopping it. So that is a concept of the Indian milk ladder, which is a recent concept. But even the cooked foods and the amount is given in the recent guidelines in the journal Nutrients. But it's little cumbersome to actually put it into clinical practice.
I think
Thank you, sir.
there's a very good article written by my beloved friend, late Dr. Nagaraju. He has written a book on basic concepts in allergy and immunology. His book is there. It's a very good book, and he has written something about immunotherapy, and he was trying immunotherapy for children with cosmic protein allergy also. It's very important that the PGs should be familiar with this book textbook on pediatric allergy and immunology written by late Dr. Nagaraj. Okay.
Okay,
If there are no comments, any other comments? Jose?
I am sharing the release of our today, the 75th issue for this is the 70th issue in the PG Tips is concerned.
Okay.
These all our PG Tips are uploaded at IEP Kerala website. The previous articles also available. Every articles are uploaded. Those who are wanted to have the article, we can go to our IEP Kerala website. You can easily download can able to download all the PG Tips for the last 1.5 years. So thank you, Dr. Sumar sir and Dr. Susie, Dr. Needu for excellent topic discussion on one of the common issue, the food allergy, cow's milk protein allergy. Especially thanks Sumar sir for taking all the initiation to coordinate this program for the today program, and excellent discussion regarding the cow's milk protein. And again, thanks Dr. Santosh sir for throughout the program. He is actively involved in the program. I thank you, Santosh sir, for IAP Kerala. Now I invite Dr. Krishna Mohan to conclude our topic. Any comment from Shankarji?
Two questions are there in the chat box. One is PG Tips article. Sorry, they have asked for the PPT. Somebody has asked from the note. So actually, everything is in the PG Tips. Today, what she presented is the entire presentation which is present in the PG Tips. So as Josa told, all 75 issues are in the IAP Kerala website. It is one of the area where maximum hits are there now. All 75 articles are there. So you can go there. And I am also thanking the other Neetu and Susie, excellent mentor, and our reviewer also, Dr. Prashant KS, is a pediatric gastroenterologist. And all other members of the PG Tips, Dr. Mohandas, Dr. Priya, and other members for helping me for this editorial board. That's all. Over to Krishna Mohan.
Okay, sir. So once again, thank you all for your valuable presence, and especially to Santosh Sohn sir for being with us all through the program from the beginning to the end. And special thanks to Dr. Neetu Chandran for that excellent presentation, and Sukumaran sir for chairing the session, and mentor Dr. Susie Joseph. And once again, I thank Jose sir, who is a person. So thank you so much. Thank you all.
Thank you.
With this, we can stop this thing, and good night for today.
Santosh sir, thank
Good
you.
night. Good night.
Good night,
Thank you.
everybody.
Good night.
Thanks a lot. Great seeing you today. Bye.
Good night. Good night.
പ്രായത്തിൽ കുഴപ്പമില്ല. ഞാൻ ഇത് നോക്കിയപ്പോഴത്തേക്കും നമ്മുടെ കോൺഗ്രസ് കിട്ടാൻ പാടായിരുന്നു. കിട്ടാൻ പാടായിരുന്നു. എഴുതിയിട്ടുണ്ട്. തൈറോയ്ഡ് സീറോയിൽ തോന്നുന്നില്ല കേട്ടോ. കുറച്ച് കൗണ്ടും ഒരു കൗണ്ട് CRP നോൺ ഹെൽത്തിയാണ് വേണോ വേണ്ടിയിട്ടില്ല കൗണ്ട് ഞാൻ തോന്നുന്നില്ല. പിന്നെ കഴിച്ച മാറുന്നില്ല കുറയുന്നില്ല. ഒരു 6 7 ഇപ്പോഴും നമ്മൾ 5:30 പനിയുണ്ടോ? ടെമ്പറേച്ചർ കൊടുക്കാൻ നോക്കട്ടെ കൊടുക്കാം. ടെമ്പറേച്ചർ നോക്കുക. അവിടെ കൊടുത്തിരുന്നു. അതൊക്കെ കൈവച്ചാണ്.